Hello dear medicos. Welcome to our YouTube channel Medico Prep. We are going to start video series on pediatrics and we hope it will help you in learning pediatrics in a short time. And today our first topic is acute epiglottitis. Epiglottitis, as it indicates from his name, means inflammation of epiglottis. It happens when the epiglottis, a small cartilage, laid, that covers the windpipe, swells. The swelling blocks the flow of air into the lungs. Epiglottis can be deadly and anyone can get it, but once mainly children's got it. It is considered as a medical emergency, so patients just need to rush to nearby hospital or see a doctor to monitor ABCs. In which patients, airway, breathing, and circulation is assessed, so it can be managed accordingly rather than proceeding further in diagnosing the disorder. Most common cause of epiglottitis in children was infection with Haemophilus infection type B, also known as HIV bacteria. Nowadays, a routine HIV vaccination for infants has made epiglottitis rare in children, but it is still more common in adults. So now we will discuss about the clinical features or symptoms of the acute epiglottitis. A woman may comes to your clinic with her kid saying that her kid had a sudden onset of fever, sore throat, stridor, also known as high-pitched sound, drooling of saliva, and she might tells you that her kid is also acting anxious and irritable, with muffling or changing voice. Patient may leans forward for some help in breathing. As epiglottitis is considered a medical emergency, so first we need to ensure that the patient's airway is open and enough oxygen is getting through. If oxygen levels are too low, then that patient needs breathing aid before diagnosis. When breathing is stable, then we can perform certain tests and exams to help us in confirming the diagnosis and any kind of infection. First, we can do a full examination of throat. The most common and diagnostic test for acute epiglottitis is lateral neck X-ray. We can also get throat culture and blood tests to find any infection. On lateral neck X-ray we can get a thumb sign appearance. Now let's discuss about the management of the acute epiglottitis. In management, we will first help patient with breathing, which can be done by supplementation oxygen and mask ventilation if symptoms worsens. Next step is treating infection which is causing the airway constriction. It can be done by prescribing patient with broad spectrum antibiotics like ceftriaxone. We can also use corticosteroid like oral dexamethasone, which will help patient in breathing. Prednisolone can also be used as an alternative to dexamethasone. Follow and subscribe us for more videos like this. And don't forget to share it with your friends as well.